So in this section, we're going to talk about the genus Bacillus. And hopefully you do remember from your microbiology class that Bacillus also is the term we use for rod-shaped organisms. But this is the particular genus Bacillus. It means small rod. The two species that we're going to talk about in this section that are members of this genus that cause human disease are Bacillus anthracis, which causes anthrax, and Bacillus cereus, which often causes gastrointestinal issues. You can see from this image the rod-shaped bacteria, some of which have formed these clear structures, which are endospores, and this is a gram-positive genus. Bacillus anthracis, again, the causative agent of anthrax. Now, anthrax is one of these diseases that is not necessarily caused by the bacterium itself, but it's actually caused by toxins encoded in plasmids. So the particular plasmid that encodes the anthrax toxins is called PX01. There are 3 genes on PX01 that lead to toxin formation. These 3 genes can combine, their protein products can combine in 2 different ways to form 2 toxins. So the proteins encoded by these genes on this plasmid are lethal factor, protective antigen, and edema factor. So either one of the factors, lethal factor or edema factor, will combine with protective antigen to form a toxin. So when lethal factor and protective antigen get together, they form lethal toxin, which causes tissue damage and eventually can lead to shock. When protective antigen combines with edema factor, we get edema toxin, which leads to edema. So 3 proteins, 2 toxins. There is another plasmid called PX02, which allows Bacillus anthracis to form a capsule. But this has been really tricky for scientists to study because the capsule generally doesn't form in vitro. It only forms in vivo. So scientists haven't quite yet figured out how to get the capsule to induce in vitro. Anthrax is mainly a disease of herbivores, so that's why, well, it's part of the reason that it persists in the environment is because it infects things like cattle, reindeer, right, herbivores. And human infection, especially in the US, is relatively uncommon. So in the US, there were only 5 cases reported between 1981 and 1999. There was an accidental release of anthrax in 1979. I don't remember which country, but I believe it's in the former Soviet Union. And then, of course, in 2001, in October of 2001, so basically 1 month after the terrorist attacks in September, there was a terrorist release of anthrax. And that basically consisted of anthrax spores being sent in the mail. And probably many of you are too young to remember what that, was like going through. But it was a very scary time because, again, we had just seen planes crash into buildings on the East Coast, like the World Trade Center and the Pentagon. And then people were dying of anthrax because spores were being sent in the mail. They were being sent to Congress. They were being sent to tabloids. It was a very, very scary time. And that's kind of the idea behind terrorism. You want to scare people to get them to do what you want. But it turned out that this was the person who has been accused of doing this is actually a US-based scientist who died by suicide after it became clear that people thought it was him that had done it. There are 3 forms of anthrax disease. And again, we're most worried about the form caused by inhaled spores, so inhalation anthrax. But I've got a headline here: anthrax sickens 13 in Western Siberia, and a thawed out reindeer corpse may be to blame. So in a class like this, we often are, people who are interested in human health, pre-med, CLS, and sometimes we don't appreciate other fields of biology, for example, ecology. I can't tell you how many students, why do I have to take ecology? Well, listen, this is a disease of herbivores, including reindeers. So a herd of reindeer in Siberia dies of anthrax. The corpses either freeze or, decay, whatever. But let's say it's Siberia, they froze. Bacillus species can form these endospores, these highly resistant structures that we talked about in an earlier lecture video. When conditions become nice again, say we warm up because we've started to thaw out because of climate change, the permafrost begins to thaw, you now have the release of these spores. So it is important to understand, ecological cycles, climate change, and evolution when you're thinking about medical microbiology. So again, the 3 forms of disease are listed here. Cutaneous anthrax, which is basically a skin infection. This generally does not progress to systemic infection, but it can. And the major symptom is going to be an eschar formation, so like a black wound that will form at the site of wherever the spores or the bacteria got into the skin. Gastrointestinal anthrax is if you consume most likely a spore that then germinates or becomes vegetative in the GI tract. This can be fatal pretty commonly without treatment. And then inhalation anthrax is if you inhale the spores and they germinate in the respiratory tract, especially the lungs. And again, most patients with inhalation anthrax will die unless treatment is initiated immediately. The lungs, because of the edema toxin, fill with fluid. The lethal toxin destroys the cells and tissues, so it's irreversible lung damage. Okay, and again, this is not something that's rare in the US in terms of we don't really have anthrax in the US. We have it everywhere. It's just we don't usually see it in people. So anthrax has been confirmed in a group of cows in a pasture in North Dakota. What's behind animal deaths in Texas's anthrax triangle? Well, it tells you right there in the headline, anthrax, right? The anthrax triangle. So wildlife and livestock can get and do get anthrax. The cutaneous form of disease is most common. 95% of infections with anthrax are going to be that. The inhalation form is caused by exposure to spores. And it used to be called wool sorter's disease because, again, animals like goats can get anthrax. And so when people were processing goats, especially for their hides, the spores would dry out in the hides. And then as the people were working with them, they would get in the lungs and people would get anthrax. Of course, we have seen release of anthrax spores as terrorism, which I already described. There's a very low infectious dose. It's not like you have to inhale tons of spores in order to make you sick. So that's one way, and I know this sounds very dark, but that's like one way or one reason it's a good agent to use for terrorism, because you don't need very many spores to make somebody sick. On the other hand, it's kind of a bad bacterium to use for terrorism because it doesn't spread person to person. So if your goal is just to scare people, sure, anthrax sounds really, really scary and you can make some people sick. If your goal is to make a lot of people sick, this is not a great choice because you'd constantly have to have people being exposed to spores, which isn't super common. So here we're looking at the cutaneous form. You get that a papule or a lesion or an ulceration at the site of inoculation. Eventually it will ulcerate and go necrotic. It can go systemic, and if it does, that's when we see that mortality rate. So In about 20% of patients, maybe a little bit higher, it can go systemic, and that's when we start to see mortality. But if you get this treated relatively quickly, you will most likely be fine. The gastrointestinal form, you'll get ulcers in the mouth or esophagus wherever the spore is attached and the bacteria started to germinate. You will get nausea or vomiting if the infection occurs in the gastrointestinal tract, like the cecum or the ileum. And if left untreated, this is 100% fatal. For the inhalation form, patients can be asymptomatic for 2 or more months. It can really take time for the bacteria to germinate, to get enough toxin produced in order for symptoms to develop. So that can be really scary too for patients who may have been exposed, to have that waiting period of, are they going to develop the infection? The spores are phagocytized in alveoli and transported to local lymph nodes. And again, it's the release of the toxins that cause disease. So in patients with inhalation anthrax, it's not that they're developing pneumonia, because pneumonia is like the infection in the lungs. It's that the toxins are leading to edema and tissue destruction. And this is an X-ray from October of 2001 of one of the patients who had inhalation anthrax from that terrorist release. Again, if left untreated, and sometimes even if caught, you will have shock and death within 3 days. So how do we diagnose anthrax? It's hard. When somebody comes in with like upper respiratory or lower respiratory issues, you don't think anthrax, right? A patient comes in with trouble breathing, fluid in the lungs. Your first thought isn't, well, clearly they've got anthrax. You know, you think of horses, not zebras, when you hear hoofbeats. But it could be possible. So you can do a gram stain of the blood looking for the bacillus in the blood. You can do PCR of sputum samples, lung aspirates, blood, wherever you have the infection, right? GI tract, a cutaneous wound. Antibiotic therapy is necessary to get rid of the bacterium, but remember, the disease is caused by the toxin. So you have to get rid of the bacteria so they stop making toxin. But as long as the toxin is still in the body, the patient will still be experiencing symptoms, even if the bacteria themselves are totally gone. For people in the livestock industry, you should be vaccinating your herds against anthrax. There is a human vaccine for anthrax. It is relatively uncommon. Members of the military, people who work with livestock and other large animals, can be vaccinated, but the general public is not going to be vaccinated against anthrax, which again is one of those reasons why it could be scary and potentially used for terrorism.